All right, I think we can go ahead and get started. Hello, everyone. Welcome, and thank you for joining us for today's webinar, Enhancing Public Health Through Design, an Open Source Tool. My name is Twyla Neely-Strite, and I'm the Education and Operations Associate at Illinois Green Alliance. Today's program was put on by the Illinois Green Alliance Programs Committee, a volunteer group that coordinates education events covering a wide range of topics throughout the year for the green building industry. The team that organized today's event consists of Sydney Van Kuren, Helen Ho, and Madeline Stanton. You've all been muted upon entry, so please type any questions you have into the Q&A button at the bottom of your screen, and we'll get them answered at the end. And this webinar is being recorded and will be sent out to you with other resources in a follow-up email. For those who are unfamiliar, Illinois Green Alliance is a membership-driven nonprofit organization that advances green buildings and sustainable communities for all. Our 5-year strategic plan pushes the green building industry to meet or get on the path to net zero. We achieve this work through education events such as panels and building tours, by engaging communities and partnering with organizations across Illinois, and by advocating for new policies and legislation. Members can view our recorded webinars through our on-demand webinar library. You can also learn more about membership and see upcoming events and get involved by visiting our website, illinoisgreenalliance.org. And I also want to take a moment to recognize Illinois Green Alliance's sustaining sponsors who make our work possible. A special thank you to our gold level sponsors, ComEd, USGBC, and Sloan. Make a commitment to advancing green buildings in communities across the state by visiting illinoisgreenalliance.org/sponsorship to start a conversation about sponsor partnership today. And now on to the main event. We have a great lineup of speakers for today's program. We have Dr. Erica Etland, who is the Director of Human Experience Research at Perkins&Will, where she focuses on the public health impact of K-12 schools, affordable housing, and urban planning. She received a doctorate from the Harvard Chan School of Public Health and Environmental Health. Erica is the co-founder and co-host of the Inhabit podcast, a show focused on the power of design. She has presented her research internationally at the World Bank, U.S. Health Resources and Services Administration, American Society of Interior Design, and U.S. Green Building Council. Erica advises on national policy for the U.S. EPA as a member of the Children's Health Protection Advisory Committee. She holds a Master of Public Health from Columbia University. We also have Amina Hellstern, who is the Senior Regenerative Design Advisor and Associate Principal at Perkins&Will's Chicago studio. She trained as an architect and believes that places we design must creatively address resilience and regeneration, health and well-being, community, and inclusion. Amina also believes that designers should embed research and innovation in our practice. Amina was a key member of the research teams who delivered projects such as Healthy Affordable Housing, the Toolkit, and the Public Repository to Engage Community and Enhance Design Equity, PRECEDE. Amina also currently serves on the board of directors for the Illinois Green Alliance. After we hear from our speakers, we'll have an audience Q&A led by Helen Ho, Project Research Manager at DLR Group. Remember to add your questions to the Q&A function throughout the program so that Helen and our speakers can address them at the end. And now I'm going to pass things over to our speakers to get us started.
Thank you, Twyla. Let me just share my screen. All right, can everyone see me, hear me?
Yep, you sound
yes
great.
And yes. Okay, great. All right, so nice to meet everyone. I hope you're having a great day. It's a beautiful day in Chicago. We're here to talk about PRECEDE, and that is the public repository to engage community and enhance design equity. This project began when we at Perkins&Will asked the question, how do we embed public health priorities early into the design process to reflect community and context and occupant needs, and for this question specifically in the United States. And we really felt like if we really helped designers focus on this very early, that they could have really large impacts as soon as an RFP came in. And so we are going to embed some questions into our presentation today that require audience participation. So I am going to flip to
And please do it, because do not leave us hanging, because if you leave us hanging, this will be less fun for all of us, I promise.
So you can either do this on your laptop, or sometimes it's easier, I find, when I'm watching a webinar on my computer to do this actually on my phone. There's a website that's available. There is also a QR code that you can click. So I'll give people a couple minutes. If you're using the website, you do need to enter this code, which is 289696153. If you are watching this after the live webinar, this will not be available for you, just as an FYI. This is only going to be for live audience members. All right, so we're going to give this a test. We're going to go to our first question. And that question is, when you are designing, have you ever integrated public health metrics into your projects? And your responses could be yes, no, or perhaps you're unsure. And I see that it's working. So we've got live results coming in for us. And we're split across the, unsure is taken over. All right, well, I think as we continue to watch this grow, I think what we're learning here is that potentially you've embedded those public health metrics, maybe without knowing it, into your projects. And today we'll help you uncover that more and learn more about that. Erica, anything else on this slide before we go to our next question?
Yeah, I think this is just an opportunity of that this will become clear, and hopefully by the end you're like, yes, every time I integrate public health. So it's nice to know that this is an opportunity where hopefully this next hour will be really informative and impactful. So I'm happy to see that.
Awesome. All right, so our next question for the audience is, when you're talking to your clients, what health impacts do you discuss during the design process? And this is an open-ended question, so we'll give people a little time. I always wish that we had a little music, something to bebop to while we're waiting for responses to come in. All right, so we've got at least one response coming in, talking about occupant health. Wellness and biophilia, yes.
And I'm curious, like from occupant health, yeah, exactly. What are these specifics around wellness?
Ooh, we
Get
got a
of
lot of indoor air quality coming in.
one of my favorite topics.
I know I've got some active design, so physical activity, movement. I do see a mental health, so that's a good note up there. Ooh, social determinants. Okay, that's great. Daylight access, views in daylight, access to nature. Another mental health coming in. These are all great. Ooh, food and beverage, which as it's lunchtime does sound quite nice. All right. I think we've got a good idea of what people are thinking about so far. So we'll continue to kind of address this as we go through the presentation. So I am going to.
We're on a journey for sure.
Hand this
All right.
to Erica.
We've become one brain, Amina, never fear. So before we jump into describing what exactly PRECEDE is, I just wanted to share about how did it come to be, and where did it originate? So we're really lucky. We submitted a grant to the American Society of Interior Design Foundation, whereby we were awarded the Transform grant at the end of 2022 and received $30,000 with $30,000 matching funds from Perkins&Will. So it has really taken a village to take this from what started as an Excel spreadsheet and that research question and actually be able to share with you today, sort of the bigger nerdy pieces. But as we kind of move forward, I think what makes this project really special is actually who worked on it. So we had members of our team from every scale represented, all the way from urban design and interiors, research. We also knew that in order to bring public health into the design profession in a meaningful way, you needed all those different folks at the table together, paired with sort of the data analytics of people who knew how to use that information effectively. And what's powerful is that because of being able to work remotely, and maybe this partnership would have been different pre-COVID, we were able to tap into a number of studios across Perkins&Will, but also through that funding, be able to hire graduate students from the Harvard Chan School of Public Health, my alma mater, as well as the GSD, and be able to ensure that we were also including people from principal level all the way into sort of early design parts of their career to really make sure that this was a tool that worked for everyone and needs were being met across the board. So exciting stuff. So as we get into this, if you're a multitasker, I'm with you. Definitely feel free to open the tool, play with it, because it is open source. We were really deliberate on wanting to make this an opportunity for all of us to share in this work together. It's not enough for Perkins&Will to say, we love kids more than you do. We're past that point. This is too urgent. It's too important. And so we're hoping that as you get into this tool, you can use it, share it, share it with emerging students who need that practice. So PRECEDE.perkinswill.com. So I think one of these pieces that you all might be like, oh, yeah, we know this part, but why public health in design? And I want us to just provide a framework first. So as we kind of get into it, that there's sort of the key World Health Organization definition. And what that is it's the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So when I see a lot of those responses reflecting indoor air quality, it is about that maybe absence of disease or infirmity that is really triggered by COVID and recognizing this incredible relationship we have. But from that, we also know that there's so many other pieces, cognitive function, sense of connectedness and belonging. And so we have, I think this definition is something that we all as designers get to take forward and move through. And the way that I see it is actually through the socio-ecological model. So if we think from the outer part of these concentric circles, the way that we design our communities and sort of urban plans and public realm kind of trickles down to what are those health components that are hitting in our building level places. So everything from schools to workplace to healthcare, and then the interiors and how are we nudging behaviors and sort of bringing people together within that space so that we ultimately impact the physiology and psychology of the occupants that live within our environments. And so to me, one thing, it's important to acknowledge, how buildings and built environment has impact on our health, but we recognize that this isn't happening equitably. So when we look at things like access to green space and parks, we see that it's disproportionately impacting our non-white communities, whereby they don't have the same access. When we think about it from a school level, we see that most of our school buildings that don't have air conditioning, again, are disproportionately impacting Black and Hispanic students. So there's a need for us to think about this, not just through a public health lens, but through a health equity lens. And that is really what PRECEDE is trying to get us towards. So as we get into it, there's this incredible opportunity to know that data exists, but we have these knowledge silos that are persisting. So there's plenty of data out there. You, I'm sure, have your favorite dashboard. For us, it was City Health Dashboard, where we were looking and they had 500 of the largest cities in the US. Great, but not all of our projects are going to happen in cities. So what about those other spaces? Then we look to the CDC, so the Center for Disease Control and Prevention, and they have this incredible dashboard. But again, you needed to have the public health context to know how to interpret some of this information. And it was mostly on the healthcare side of it, not about some of the preventative work. To me, environmental justice is incredibly important as we recognize sort of our relationship to redlining and how are we going to go above and beyond in our design environments. And yet we see with EPA's EJ screen, there's still need to kind of look at these outcomes and know how to help inform our designers on how to best respond. And then you get to something like the Savvy dashboard, which is just for Indianapolis, so that's helpful, but it gives you this robust context around each of the indicators. So there's something for us to learn from each one of these examples, and yet how do we get to design? How do we get to action once we know all of these pieces? And so what's exciting is that we know solutions exist to address these individual problems. And for me, what this tells me is that as much as I would like to believe, the public health in me, that everybody will get a healthy building, you know what? In some communities, we're going to have to prioritize what are the health priorities. And then how do we respond directly to asthma? Or do we respond directly to transportation noise and thinking about acoustics? So there's going to be a tailored response that's required for us to meet the needs of those communities where they are when we know they can't afford or maybe have access to all of the healthy amenities we wish they did. So we're going to get into the tool now, but I hope, if you have questions about these relationships, we're happy to get into that in the Q&A, just so that we can kind of make sure this is really resonating. So let's discuss it. Let's get into it. So we wanted to kind of have a framework that was universal and helpful. And so what we found was that we needed to have sort of this three-legged stool. And so what we have is we start with learn. So this is where PRECEDE is providing educational resources on public health factors that can influence community health and well-being. Then we want you to go to explore, whereby we're going to consolidate all of that data and information from CDC, US Census, Environmental Protection Agency to provide an overview of that information for your specific project. And then from there, we want you to be able to take action. Once you've been able to prioritize those elements, what can we do from a design perspective to be responsive to those specific needs? So what are the limitations of this tool? I think this is the researcher in me. I could start a presentation with here's why this is fabulous, but I want you all to go in with an honest understanding of what this tool is. It is not here to replace authentic engagement with the communities you are serving. That is something that we see as all of your hard work, but this can be a conversation starter. We're not going to collect any data that we haven't sort of pulled in from reputable sources. It's important to us that things are collected regularly and are publicly available. And that's why it was important for us to also make this a publicly available tool. But we also wanted to feel confident in the data we were collecting. And so that's why right now it's only the United States. And the goal is to expand. So if you have colleagues in other areas of the world who would love to use this, we want their help to build those frameworks. But this is just a subset of the juicy stuff that is out there. And so for you, if you feel compelled to kind of dig in more, those resources are available to you. So let's start off with just thinking about the resources that we have for you all to make this as, your trip to PRECEDE as successful as it can be. First, we have a pretty robust user guide. This was really important to us because we want you to be able to navigate this information, but also there's nuances with working with public health data. And so we didn't want that to be overwhelming, but really know why we were making certain decisions. And so what you'll find, this is one of my favorite charts in this entire document, which is being able to understand, the specifics and the rationale behind certain decisions that we've made in the tool. And if there's still questions that after reading this you don't know, please contact us because we would love to know. But I want to talk about some of the fundamentals. So one thing that you'll notice when you come to PRECEDE is that we've organized our information in very specific ways. So first is this discussion around exposures. So these are environmental exposures, something like air pollution, neighborhood, walkability, or extreme heat. And those things, those exposures have impacts on health outcomes. So these are going to be our respiratory diseases, cardiovascular, sleep quality. And in this context, what we have to think about is that what's the frequency, the duration that we are exposed to some of those exposures? And that's going to help us understand also what is the priority and do we think that it will influence the outcome? And so one piece, as we kind of get into the specifics here, is that also being aware of what are the vulnerable populations that you're trying to serve within your communities. And so this might be people with chronic conditions. It might be school-age children who are rapidly developing and growing. It might be people who don't have access to things like air conditioning. So as we think about it, those vulnerabilities and exposures are going to influence who actually develops those health outcomes. So just kind of as you move through the tool, you'll get a sense that we have organized it in that way. But within the exposures, one thing that was really important was also acknowledging that there are different categories. So there's some things that we're going to want to increase our exposure to, so things like greenness or walkability, but there's also things we're going to reduce our risk. And so our risk mitigation indicators. And so those are things like extreme heat, noise pollution, waste proximity traffic. And yet we also see that there's overlap when we start to talk about our climate adaptation aspects. And so these are things that we know by measuring that there's going to be actual or expected effects of a changing climate on those factors, and that might influence the way that the community is responding in that space. So as you know, again, just trying to understand the association, you'll see later in some of the resources we provide, as we think about these environmental factors, exposures, those are the things that we can have impact on and intervene so that we don't come to the outcomes. But these are also going to be confounded by some of these socio-demographic factors, some of the community context, and a confounder is associated with both the exposure and the outcome. So being able to say that we know people over 65 are more sensitive to particulate matter and air quality, and yet they're also associated with a higher risk of having something like chronic obstructive pulmonary disease, or COPD for short. And so that's something to connect with. But also we know that there's what they call moderators. So these are things that even if you're exposed to particulate matter, maybe you're in a red burdened area, that's going to increase your potential risk to something like COPD. So these other factors, it's not as simple as, well, X causes Y, because we know we live in a complex system. So wanting you to be aware of that as you interpret the findings later on. So what does PRECEDE do? It's hopefully allowing designers to holistically evaluate the project in a community context, the magnitude of exposure, burden of disease, as well as understanding the specific vulnerable populations we need to serve. So this is the exciting part, and we'll go through it quick because I want you also to play with it and I want us to get to Q&A. But first is learn. So this is our educational component of the tool. And as we think about it and get into the next piece, is just, this is a chance to increase fluency. So on the next slide, what you'll see is that we just have these cute little comics that are going to walk you through on how to basically use the tool. Again, there's a deeper dive in our user guide. But what will you find when you come to the Learn page? So it's exciting because we have provided a series of cards and information that help you understand, why should I care about ozone and design? Why is noise pollution important? And so these are just going to give us those short descriptions. But what we have provided also is the ability to browse. So this is something where you can select and say, I only care about the exposures. I want to know more. What is NDVI, for example? Or it's like, I know what my exposures are, but which one? Is it something I want to health promote or climate adaptation? I need to get into it. So we have a robust list of indicators you'll see that are represented across both Learn, Explore, and Act. And so these are things that you can find information on in PRECEDE overall. But I feel like as we were preparing for this presentation, it was really exciting for Amina and I to be able to just bring in a real world example real quick. So Amina, I don't know if you want to kind of share your hot takes.
Yeah, so if anyone was in Chicago last June, you probably remember that wildfire smoke overtook the city. And not only did it overtake the city, it was led to having the worst air quality index of any major city in the world. So this is a source of exposure, right? And it's real world. And often if we're thinking about something like resilience, we're not thinking about Chicago as a place for wildfires, but if we're thinking through the lens of health, this is an exposure that is impacting us. So we're going to flip to the next slide, which Erica will explain, but it really talks about wildfire and wildfire smoke impacts on health.
Yep. So this is something that once you click on those cards, you'll get the deeper dive. And it was important for us that this is also work that we get to do. This isn't to go in with some sort of white savior complex. We are going to save everyone, but it really is about the work that must be done. And so what you'll find is that we get into sort of this lovely comic that's explaining what's happening, what are the sources, mechanisms, health outcomes, but also it's paired with the sort of deeper dive of the definition. What's the real sort of indicator that we're looking at here and measuring in our Explore tool, and what are sources of that exposure? And so within this, there's also sort of a larger list of references that you can access and sort of dive into more. But I think moving forward, as we think about Explore, this is where I think you'll spend hopefully the most time as you kind of keep coming back to PRECEDE. So Explore is going to summarize and quantify our demographic and health indicators for any location in the US. And it's going to just give us a quick kind of spot summary of what's happening. So again, at the top, you'll see what we'll say is you're going to want to click the bottom right arrow to make the dashboard full screen. I promise you this will make your life easier. You're also going to be able to select granularity and choose your census tract, but really start to search the site. And one thing that's important, and we've gotten a lot of questions on, is where did this data come from? And so we want you to download the metadata. It's in this little chart that you'll see, whereby you can just click on those references and be able to go directly to the source of that data. But we have a lot of shorthand in the tool, and so this is an opportunity for you to have just a little bit more context as we dive in. But the data is coming from so many of the places that we already discussed. So you kind of will become familiar with that as you play with it. But what do you need to know when you enter? So the first thing is we have organized the data from state, county, and census tract. These are regularly collected levels of data. We are also going to give you the opportunity to be able to think about which type of indicator, so our demographics, exposures, or outcomes, as well as being able to get the raw data information where you see number 4, whereby it's going to tell you exactly the value for what you're finding. And so as we look at this, there's also sort of this map component. And as we click through it, you'll start to see this will animate as we are looking at this different information. So once you've searched an address, it'll bring you to this location so for us, it was Boston and the Boston studio for Perkins&Will. And we first need to click on that geography, and it updates the information on the right side. So that's going to tell me what are the health priorities here. And what we see is that as we click through this information, as we did also for our Durham School of the Arts project we were working on, it allowed us to quickly start to zoom in and understand what are those key health factors and how might they change based on the granularity. So one thing that's really important as you're using this tool is we want you to use census tract if you're going to be thinking about neighborhood community scale. It's an imperfect measure because it might not reflect the true neighborhood boundaries, but it's a small enough granularity whereby we can be more confident in the results that we're getting and start to see some of that variation. And what's really nice about using census tract is also it allows us to bring in all these different data sets in one places. And so as we click around to these different neighborhoods, we were able to see that there's variation in what are those health priorities that we're trying to respond to. So time for a question for all of you. This is more of a practical one. Say you're using Explore. How would you confirm the findings from the Explore tool with the community or client you are serving? So we're going to have only so much data provided by PRECEDE, but I'm really curious for all of you, what is it that you would do to make sure, are these findings correct? And so this is an open answer, same Mentimeter that we were using before. Study the metadata. I don't know, pre and post occupancy test.
The good thing is we're going to tell you the answer to this.
Yeah, no, I think that's great. Community members, ask them to reflect and validate, super, and confirm those priorities in those community meetings. Exactly. So this is exactly what we wanted to hear. I don't know, but also where do we go next? And so that's why for us, it was really important for us to exactly validate those findings of PRECEDE. And so we created the engagement and validation guide. And this is an opportunity just to have resources to facilitate successful community engagement. And so why validation? Why is it important? Like, we got the data, now let's go. That, again, PRECEDE is a conversation starter. So validation is this process of presenting those research findings to our community stakeholders and then working together to build consensus around what do we need to take action on. And really, until we do that sort of data sharing and show that we've done our homework to some extent, we might not actually be getting the full public health picture. So we don't have information robustly on mental health or burnout. And so how can we go through this process to start to understand what are the most important factors for the community we're serving? So what you'll see is that in this process, we have engage, whereby we're just starting to thoughtfully and sensitively create our design for this process, but then we go into explore. And that's going to help us understand exactly what those data tools are. We're going to be able to bring in some of that historical context because this project did not happen in a vacuum. And then as we're going through this, we also will get into the ACT tool, whereby we can maybe identify potential strategies. Are those the most accurate, or do they need greater detail and depth? And then we can do some observations on the ground. So as we just kind of go through this, definitely take some time, read through this robust guide. But this is, starting the design process with engagement is crucial for a couple of reasons. We want to have open dialogue. We want to make sure we're identifying community needs and preferences, but also wanting to make sure that our solution is truly addressing their needs and not what we think the problem is. And so how do we do this? How do we identify some of those communities? So in this guide, we're going to get into some of these key points. We're wanting to figure out where is the most vulnerable communities. And this could be something where it goes back to our conversation about what exposures do we care about? What's the duration or frequency of time that they're spending, in a given space? And that might help us understand. Also just recognizing the historical barriers to community participation. How are we going to break down that and make it a more inclusive and sort of fulfilling experience and safe space for them, as well as being able to not only reach out to community groups and leaders, but really think about our youth and other sort of parties that are typically not in that design process. And so as we go through it, what you'll find in this tool is that we are going to provide lots of different engagement approaches. We're going to provide different questions for you to consider. I love this table because there's pros and cons to all the different ways that we can engage, from regular mail all the way to social media, thinking about workshops and one-on-one meetings. And we feel that as we go through, there's equity considerations that can help us understand accessibility, access to that community, user friendliness, and just the need for compensation. So definitely take some time to check out the resources. And so lastly, one thing that's really near and dear to my heart is just thinking about observation. What can we do without taxing our sort of occupants? And so this is an opportunity just to look at that sort of lived experience. And there's a couple of ways we can do it at a community level and looking at some of this additional data and information, activity mapping, thinking about social media evaluations and sentiment analysis, intercept surveys where we just kind of snag people and say, what do you think about this? Or at the interior level, this is something where we can bring in our sensors. We can look at, what activities people are doing, thinking about occupancy sensors. So there's lots of other opportunities to pull in data outside of PRECEDE that you might be considering. So, Amina, all you.
All right. So after you identified the priorities and also validated those, the next step is ACT. So here's where we're actually providing design recommendations that respond to those public health priorities. As mentioned, there's a little tool at the top that gives you some key instructions on how to use this tool on the website. And it's also important to know that there's ongoing research. So all of our strategies are validated with relevant research studies, white papers, or best practices. PRECEDE version 1 really focuses on the interior scale, but there are plenty of options, as we all know. All buildings have interiors, so keep that in mind. And that there are 91 design recommendations to optimize occupant and community health that have been researched and presented in the tool. So if you're on the website, the tool will look a little bit like this. It is something that you can click through. It's a database of strategies. So once you have identified your exposures or outcomes, you can then click on those, as you're going to see this little illustration where you're clicking on those, and you can actually click on multiple at the same time, but here we're clicking on one at a time. You can look at the scale of your project that you might be looking at, and then you can actually dig in a little bit further. If you want to click on a single design recommendation, you can get into a little bit more of the information on what the strategy is and some of the first sources and research. So I'm going to talk about a couple of case examples, and it's important to set the stage here that these case examples were started when we first began our research on PRECEDE. So these were both projects that were started in 2020. which is when the research began. And the tool was not released publicly until November of 2023. So you can see quite a gap between when we started and when this was actually released. So a couple caveats are that you'll see that there's some background and some preceding information in here where we looked at the different tools. And the other piece on this is that there was not a robust amount of community engagement as we were just kind of testing the tool itself. So those are both caveats to this. So first, we're going to talk about Greenpeace headquarters. And if you aren't familiar with Greenpeace, but this audience, I believe, will be, they're a national nonprofit organization. They're focused on protecting the environment and specifically reducing the impacts of climate change. They are really focused on the environment and vulnerable populations. And as an extension of that, they're really looking for an inclusive workplace that supported employees from all different walks of life. So here you can see in the PRECEDE tool, this project is located in Washington, D.C. At 1300 I Street, which is in the heart of the business district. And you can see in this screenshot that some of the demographic vulnerabilities for the location include English as a second language and income disparity. As I mentioned, because this was a beta project, we were actually testing the process out, but hadn't actually yet developed the tool. So we were using between 6 and 8 different databases to pull information. And on this slide and the next few slides, you can see maybe how cumbersome that process might have been initially. So we conducted climate risk assessments using 3 different sources that revealed increased risk of heat and extreme storms with associated flooding. So these images are from CDC Places, which is a database that indicated a prevalence of high blood pressure, asthma, and cancer in the Washington, D.C. metro area. So these graphics are really a great example of why different levels of granularity are important. And this speaks to one of the questions that's in the Q&A box right now about indicators and what you would look at for workplaces, because people are coming in from multiple areas. So here, employees commute from Maryland and Northern Virginia into the district. And if we were just looking at the neighborhood scale or census tract level, we would really miss that larger context. So these images and graphs really show a great story about diversity in the population of DC, but also about neighborhood segregation. So not surprisingly, we're seeing a relationship between the neighborhoods that have greater ethnic diversity and a shorter life expectancy. These images are coming from EPA EJ Screen, and this really expands on those metrics, indicating high levels of linguistically isolated and people of color in the population. And now back to really looking at what this would look like on the PRECEDE website. So instead of going to all those different multiple platforms, PRECEDE is actually allowing us to capture all this data in one location, and frankly, with a click of a few buttons. So we took the priorities from the vulnerability assessment, aligned those with the project drivers that have been identified during visioning. And as you can see by the highlighted colors, started to indicate graphically where the project drivers could contribute to addressing some of their vulnerabilities. For instance, asthma and cancer can both be impacted by chemical exposure and air quality. Access to nature can positively impact mental health outcomes. So really, the thing that we're going to focus in on, though, is that Greenpeace's mission aligned directly with those climate vulnerabilities. So the primary focus for this project became really reducing greenhouse gas emissions. And some of the ways that we tackle that, we're really looking at material reuse and application. And I'm going to show you examples of how that was done on the next few slides. So an important part of the process was communicating to the client how those design strategies were directly related to project goals. So the presentations that were compiled put a connection between the strategies and the impacts front and center. You can see how we highlighted on the right-hand side different features in the graphic to help them identify what was going on in the image. This process really helped with also guiding them towards a site selection and selecting a space that had an existing conference facility that can be seen on the left side of this image that could be reused. This saved the client costs, but also lowered embodied carbon. Additionally, the wood ceiling that you see in this image and the walls were designed with mechanical fasteners instead of glues and adhesives, allowing for disassembly and reuse, flowing back into that circularity story. Again, here as we're looking at different ways that we're reducing embodied carbon, those reclaimed wood slats, carbon neutral tiles, a lot of salvage millwork from the space and relocating it within the space, as well as carbon sequestering wood materials in the light fixture. So the furniture was selected with EPDs, and there are parallels between the low embodied carbon and healthy materials with the ceiling and flooring materials, as well as working with the general contractor to salvage drywall, insulation, studs, conduit, and blocking from a site that was nearby and being demolished so that we were actually able to reuse them on this project. So the combination of all the approaches on this project realized a significant reduction in the embodied carbon. And this graphic indicates the reduction emissions from material use to be 46%. And this graphic, it's called the Sankey diagram. So it's a fun little diagram that we're looking at. And it really indicates how those different material streams, both new and salvage, contributed to the overall reduction in embodied carbon of 54% for this project. So that's really connecting both the priorities of the client, the health priorities of the community with the actual design outcomes. Next up, we are going to talk about a project that is a little bit closer to home. It's called Thrive Inglewood. And this project is located on Chicago's South Side in the Inglewood neighborhood. It's commonly known as one of the most economically challenged and dangerous neighborhoods in the city. Inglewood itself is emblematic of, an urban history and evolution in the US with growth, decline, segregation, reinvention. It was once one of the largest and most successful commercial centers outside of the Loop in Chicago at 63rd and Halsted, and really faced rapid decline due to urban renewal era policies. So if you fast forward to the past decade, the neighborhood has now several anchors, including Kennedy King College and Inglewood Square, which has the first fresh produce serving commercial grocery store to serve those neighborhood residents in over a generation. So this is right next door to Inglewood Square. So the project is a 61 unit mixed income rental housing development. 51% of those units are at 50 and 60% area median income, and that's really technically considered affordable housing. There are also 10 units that are considered market rate or do not have an income cap on those, but they're still below 80% of the AMI, so they're still affordable within the neighborhood. The developer here is DL3 Realty. They're a BIPOC developer, and they're really focused on impact and high social benefits on the projects that they work on. This project is pursuing the Enterprise Green Communities certification. We're working with our local friends at DBHMS to help deliver this. And this all kind of ties together. So let's talk about how it looks in PRECEDE. So really looking at the demographics, this community ranks 78th percentile for less than high school education and 84th percentile for unemployment. If we really look at the population of the neighborhood, further, almost 95% of Inglewood's population is Black. And as we start to look further, 44% of Inglewood's population is below 100% of poverty level, and 75% of the renters are cost burdened, right? So this is a very challenged community in terms of demographics. If we start to look at the exposures of concern that we can see on the far right-hand side, those include things like traffic proximity, waste proximity, lack of insurance, air quality, noise pollution. So all of those are impacts that are important to this community. There's also a long list of outcomes. I mean, almost every one of the outcomes that we've listed is identified as a point of concern here. And this includes physical activity and obesity to asthma and COPD. And in fact, the only outcome that's identified by the data not to be a concern is cancer. So for this community, there's a lot of opportunity for our design to help. So with all of the potential exposures and outcomes of concern, there are a ton of design recommendations, but today we're really going to focus in on one of those, and that's asthma. So asthma is a health outcome of concern, and it's found that we've just mentioned that 95% of this community is Black, and Black Americans are 3 times more likely to die from asthma. It can reduce quality of life, resulting in missed days of schools, stress on the healthcare system, missed work days, so all kinds of impacts. And because this is a residential building, Americans spend 1/3 of their lifetimes in their bedrooms. And that's really exacerbated by those environmental conditions. So if we can help them have a healthier place to live and to sleep, wouldn't that be wonderful? So we as designers can help reduce that prevalence of asthma by the design decisions that we're making. So one of the recommendations that we looked at was really thinking about material transparency and material selection to limit respiratory sensitization. Excuse me. So we can look through optimized material selections. And in 2011, it was found that there are almost 400 substances that are linked to asthma. So lots of different asthmagens out there. This recommendation also happens to overlap with our third-party rating system, Enterprise Green Communities. We're pursuing ingredient transparency for material health, chemical hazard optimization, as well as the healthy material selection. Another recommendation for asthma includes all-electric equipment, and this building is an all-electric building. So this is a key decision that impacts not only indoor air quality, because the lights are also here going on and on, but it impacts decarbonization, building operations, energy use, as well as health outcomes. And it was found that 12.7% of current childhood asthma in the US is attributable to gas stove use. So if we can reduce the gas stove by using electric appliances, that can really also help to reduce that prevalence of asthma. So this is also tied in to Enterprise Green Communities and pursuing that credit for an all-electric building. And this is something that we are happy to do and really overlaps also with our goals around decarbonization. So I know we covered just kind of top of the line there on this project, but it's currently under construction. It's in blue in this photo. It just topped out. And we hope to share more project successes after it's completed at the end of this year. So if we do some really key takeaways, design is really a potent tool for promoting restorative justice and addressing health disparities, fostering the equitable outcomes for everyone. And design professionals, we have the opportunity to use this knowledge to make impacts for the health of the projects that we're doing, as well as the broader community, as well as, applying PRECEDE to projects involves analyzing available site-specific, so specific for your project location, health data, engaging stakeholders, determining applicability, and really can help you create a tailored action plan for implementing those interventions. So based on the time, I'm going to skip our next question and just move into first of all, letting you know that we've given you the website multiple times here, but it's again at the bottom. If you have feedback or interested in collaborating or want to share any success stories using the tool, you can always reach out to us. There is a link to chat with us at the top, and it is not a live chat, it is an email chat with us at the top of the page, so you can reach out. We would love to thank our team. That includes the lovely Dr. Erica Etland, colleagues from all over our studios, as well as external collaborators. So with that, we will head into Q&A.
Thank you, Erica. Thank you, Amina. That was a really great demo and really fascinating insights into how data can drive decisions on designs. We do have one question in the Q&A that's outside of this event today. What trainings are available for folks to explore and learn how to use this tool?
I would say that, feel free to reach out to us directly. I think the long-term vision is that, we are able to have something recorded and you can just check it out. I think the user guide is a really good start. Like we went step by step, but, also don't be shy. I mean, I think we're here to also learn from everybody else about what is working or what's not intuitive. And I think for the record, $60,000 might seem like a lot, but when you're trying to do this many different things, this was a real scrappy effort. So we feel really proud, but we know it's not perfect. And so we're really open to sharing that feedback also, and getting that feedback.
Great, thank you. There was a question in the chat earlier when you were presenting about if you could speak to how this tool complements or supplements design certifications like WELL or even LBC. Are there ways to help designers map these strategies that you offer onto those certifications?
100%. So if you go to the ACT portion of the tool, there are strategies that are pulled directly from those resources. So it's not going backwards at this point. It doesn't say if you're pursuing WELL or LEAD, use these strategies, but it is very much a complement and very much utilizes that existing research and pulls those in as, and it lists that in the resources and strategy of the ACT tool.
Great. If anybody else in the audience has questions, please feel free to drop them in the Q&A. And someone just did. So this is a question for Erica. Could you please talk about your perspective on how you see health and environmental outcomes as linked together?
Okay, if I understand the question correct, that is the first caveat. I mean, I think one thing that's been really powerful for me is I'm not a designer, I'm a public health person from the beginning. And I think for all of it, if I just take an example of a school building, for example, I mean, I think it's everything from acoustics and let's take a teacher. We're gonna go down this bunny trail, Helen, let's go. But being able to think about teachers, the fact that 77% of them are women. And what we know about that population is that when we talk about schools, we always are like, oh, our teacher's voice. But the teacher's voice means that they are trying to overcome the background noise. And yet when it comes to value engineering, that part, typically the sort of voice augmentation, is getting removed from our designs. And yet we know women, their vocal cords vibrate more frequently, their larynxes are more sensitive. And so when we see it in terms of health outcomes, we see that teachers have twice the amount of vocal strain than any other sort of occupational hazard, let alone seeing that teachers have the highest level of occupational asthma, just second to minors. So and I mean coal miners. So, I mean, this is something where those built environments, if we know our teachers are in there for chronic periods of time, they're getting directly exposed to all of those different conditions we're talking about. So I don't know if that's directly it, but I think if we have these specific examples, the literature often goes back and supports, I think, these relationships. Amina, I don't know if you've got other hot takes on this one.
I think that was fantastic. I do see another question that came in.
There is a question about, is there a key in the tool that would be able to explain what exactly each of the indicators are? For instance, what counts as a rent-burdened person?
So Diamond, if you scroll up from where the Explore dashboard is, there's going to be a big blue button, and that is what we call our metadata. So the metadata will tell you a little bit more of the specific information, that how we defined it. But also, if you go to the learn portion of the tool, you can actually get a deeper dive of what does that indicator mean? Why is it significant to the work that we do? So always, don't feel shy about kind of flipping back and forth between learn and explore if something doesn't seem clear. But if you want also the data and how do they collect this data, that metadata will help you kind of get back to that information.
I'm going to use my power as moderator to ask a question of my own. And that's now that this has been a developed tool, I love that it's open source. I'm really amazed by your commitment to just spreading knowledge and having this be an open conversation. How is the tool going to continue growing? How can people contribute new design strategies, especially as innovations are developing really quickly right now in response to some of these really common exposures? Who's in charge of it to grow?
Helen, I love this question. Thank you. Thank you. That is something we ran out of time to discuss. So one of the exciting things is that if you're on the ACT page, there is actually a link where you can say, I would like to suggest these indicators or these strategies. And so you'll be able to kind of go through kind of online survey. Will say, they'll ask, is it peer-reviewed literature that's backing this up? Where did this come from? Which indicator is it associated with? So there is some of that where it's like low-hanging fruit. Here's one, go nuts. Or, to me, I think one thing is we are very open to not only having sort of multi-firm coalition on this, but also finding academic partners. I think one thing, even just working with graduate students and their sort of ability to kind of nerd out on one specific thing really well, I think this has become a great learning opportunity. Even just this last semester, we had PRECEDE as a part of a course at Georgia Tech, and a whole bunch of engineering students who would never have thought about health or, greenness in their buildings really started to use that language and know about it. So I think we are down for that collaboration. You can reach out directly to Amina, myself. This is something where we are the ones doing the work and also championing that work. And we want it to be successful. I think we're also looking genuinely for funding because this is a research effort. And so, we've been submitting for grants whereby, can we develop just our K-12 education component? Can we just focus on healthcare? Because there's so many unique strategies that are only going to work in some of these contexts that we also want to make sure we're being honest about and illuminating in the way that, people were asking about workplace. So I don't know, if you have other things to add.
No, I think that's great. And remember, at the top of the website, on every page, there's a chat with us link. So that's a great place. If you have other ideas, strategies, if you have questions, if you think something's missing or have recommendations, no one I think is more critical than of our own work than the two of us. So there's lots of things that are on our list already for things that we would love to update or things that we would love to add. And strategies are one of those. So I think that would be super helpful.
Help.
Yeah.
I love that. We're all in it together. Once we combine all of our different areas of expertise, we can really make significant impacts and break down those silos and really help to further green design. Thank you so much. I'm going to hand it back to Twyla to close things out. And thank you again, Erica and Amina, and everybody for coming today.
Thank
Yeah,
you.
just to second that, thank you so much, speakers, and thank you, Helen, for moderating. And we recorded this session and we'll be sending it out in a follow-up email along with Amina and Erica's contact information and a link to the tool. So thank you all for joining, and speakers and everyone watching, have a great day.
Thanks, everyone.